Welcome back to the National Health Career Association Pharmacy Technician Exam Training. Basic Overview, Lesson 1, and this is a part 3. In this section of this pharmacy technician training, we will be talking about or discussing about laws affecting prescription dispensing. At the end of this lesson or training for lesson 1, part 3, you will be able to understand federal and state laws and regulations affecting pharmacy. Also, you also learn about the policies and procedures instituted by the State Board of Pharmacy. Also, the last but not the least, you will understand the policies and procedures to maintain pharmacy security. Um, Before we start discussing laws affecting pharmacy, it is important to differentiate between statutes, regulations, and professional standards. Statutes are passed by legislatures and approved by the chief executive, that is the president for the federal government or the governor for the state government. Um, Regulations are adopted by executive agencies such as Board of Pharmacy. Regulations may not be adopted unless the legislature has given the regulatory agency the authority to do so. Both the federal and state governments may address the same issue. If this is the case, the more stringent, in this case, the law that is much more in-depth of the two laws will take precedence. For example, if we look at the federal law, may require controlled substance prescription to be filed and kept in a pharmacy for 2 years, while state law may require 5 years. In this case, um, a pharmacy licensed by that state would have to keep records for 5 years. Professional standards are requirements set forth by the profession, such as a national or state pharmacy association, but do not have the force of law. Well, nevertheless, these standards can be used in a court of law as evidence about the practice standard that a pharmacist or technician should have followed. Because pharmacists control the use of medications that are potentially dangerous or have high potential for abuse, pharmacy is one of the most highly regulated professions in America. Numerous laws affecting pharmacy are enforced by both the federal and state government. When both the federal and state government addresses a particular situation, the most stricter law applies. Um, Down here, I will show some of the areas that pharmacy practice that federal and state government regulate. Um, they include approval of medication for use in the United States, controlled substances, child resilient child resistant containers, patients counseling, state board of pharmacy, and joint commission on accreditation of healthcare organization, popularly known as JACO. Then the pharmacy security. I will in turn deal with these issues one at a time. Approval of medications for use in the United States. The Food and Drug Administration, known as FDA, is a federal agency that supervises the development, testing, purity, safety, and effectiveness of prescription and OTC medication. Remember from our last lesson, OTC stands for over-the-counter medications. The FDA must approve medications before they are or they can be sold in the United States. The FDA also regulates the advertising of prescription medications and the labeling of prescriptions and the OTC medications. Controlled substances are medications with a very high level of potential abuse. Good example of these medications include narcotics, amphetamines, and barbiturates. The Comprehensive Drug Abuse Prevention and Control Act of 1970, known as the Controlled Substance Act, CSA, regulates manufacturing, distribution, prescribing, and dispensing of controlled substances through the Drug Enforcement Administration, known as DEA. Prescribers, doctors and others who give prescribed medications are given or assigned the DEA numbers which authorize them to prescribe controlled substances. As a pharmacy technician, it is your duty and responsibility to check for the presence of DEA numbers on a prescription written for controlled substances. So whenever a prescription or a patient's coming to the pharmacy to refill a prescription, before you put it into the computer or put the medication through, you must check for the DEA number. In case there's the absence of DEA number, the first thing to do is to contact or speak with the pharmacist on duty. I will discuss about controlled substances later on in this course. I have a separate section to talk about controlled substances. Consumer Product Safety Commission, CPSC, oversees the 1970 Poison Prevention Packaging Act. The CPSC requires most prescription for oral use to be dispensed in child-resistant containers, unless patients or prescribers request otherwise. Um, there are some important information in this area. For example, um, nitroglycerin sublingual tablets and must be dispensed in the original and open container labeled with the following statement directed to the patient. Warning: to prevent loss of potency, keep these tablets in the original container or in a supplemental nitroglycerin container specifically labeled as being suitable for nitroglycerin tablets. Close tightly immediately after use. The Omnibus Budget Reconciliation Act of 1990, popularly known as OBRA 90, This is a federal law that increases pharmacists' professional responsibilities, mostly in two ways. The first one is OBRA 90 requires pharmacists to keep records, for example, patients' profiles of all the medications used by Medicaid patients. This patient record help reduce the incidence of medication therapy problems due to drug duplication, allergies, drug interactions, drug side effects, and patients' misuse or abuse of prescribed medication. The second professional responsibility is the OBRA 90 requires pharmacists to offer to counsel all Medicaid patients about the proper use of their medications. Um, the requirements of OBRA 90 are now interpreted to include all patients, not just those covered by Medicaid, like they said earlier on. Every patient profile must undergo prospective, which means period for dispensing, and retrospective, periodic drug utilization review (DUR). These two requirements, prospective, retrospective, have helped expand the use of pharmacy technicians as a way to allow pharmacists more time to consult patients and perform other professional services. While only pharmacists can consult patients, pharmacy technicians can also gather information for patient records and become more involved in dispensing activities of the pharmacy stock. State boards of pharmacy license all pharmacists and pharmacy departments within their states, including pharmacy technicians. Pharmacy board regulates the operation of pharmacy departments and the practices of pharmacy by pharmacists, as well as the performance of technical function by pharmacy technicians. Each board is responsible for protecting its citizens' health and welfare within regard to the pharmacy services. The state board of pharmacy employ inspectors and or investigators to inspect pharmacies for compliance with state pharmacy laws and regulations. Inspectors conduct regular inspections of licensed pharmacy departments. State pharmacy board can revoke, suspend, or place on probation licenses of those who are found guilty. There's always in this case a due process, but after the due process the of violating the laws or regulations, okay, your state's board of pharmacy regulates many tasks you perform as a technician. For example, generic substitution and license requirements and computer records, labeling, and so on and so forth. In this case, it is very important that you check with the pharmacist about your state requirement on these issues, or alternatively, you can pay your state of board of pharmacy department visit. Usually, they are located under or in a building with a health department, and also pull up a paper for your regulations. You can learn more by going there and speaking with somebody, or grabbing a literature to read more about your own state's state requirements. JACO, Joint Commission on Accreditation of Healthcare Organization, popularly known as JACO. JACO is an organization that sets forth standards for organizations such as hospitals, nursing homes, and various other healthcare facilities. For example, hospitals that meet these standards become accredited. Uh, JACO accreditation is important to improve patients' care and to make hospitals eligible for reimbursement by Medicare and Medicaid. Um, if you want to check if your organization is accredited, you can go log into www.qualitycheck.org, and you'll find more about accreditations and if your own organization is accredited. Pharmacy security. Because of the presence of medications in the pharmacy department or pharmacy store, the staff must take precautions to keep the area secure. Um, Here are some general guidelines about how to maintain security. The pharmacist must keep the pharmacy department's entrance and exit doors closed and not allow sales representatives and unauthorized people to enter. 2. Not allow store personnel to enter the pharmacy department unless they are scheduled to work in that area at a specific time. This particular section is very important. If you're not scheduled to work, you are not allowed to go into the pharmacy department or where the medications are being dispensed. The third one is to keep the pharmacy department locked and inaccessible whenever a pharmacist is not on duty. Again, a pharmacy technician cannot work unless there's a pharmacist on duty, because it is the pharmacist who actually look over the work of a pharmacy technician, and the pharmacy technician need to respond to the needs of the pharmacist, also and to the needs of the patient. So in this case, if there's no pharmacist on duty, there should not be a pharmacy technician working. As always, thank you for watching. Don't forget to subscribe to my channel for more video training and lessons. Um, you can also get extra help or one-on-one coaching for this test and other tests by going to my website www.ssteams.com/classes.html. Bye bye.